Did you know after having hip or knee surgery, there's one fatal red flag that you absolutely have to watch out for, and it's not related to hip or knee pain. Now, you may or may not have heard about this before, but one of the most serious post-op complications that you absolutely have to watch out for is called a DVT. That stands for deep vein thrombosis. A DVT is a blood clot that occurs in a deep vein. So with the hip or knee replacement, typically we'll see these around the calf region or the lower leg. Although it is uncommon for someone to develop a DVT after one of these procedures, it's good to understand why this happens in the first place. So after hip or knee surgery, what happens is there's going to be a lot of tissue repair and clotting occurring to make sure that the incision and all the tissues heal properly. Now, if overclotting occurs, that's what develops and creates the DVT, and this can potentially be fatal and dangerous if that blood clot, especially in the lower leg, dislodges and enters the circulatory system, so your bloodstream, and essentially ends up in the lungs, which we call pulmonary embolism. Now, to spot a DVT, we want to look out for some specific symptoms, starting with temperature. So the skin of that same side calf is going to be a lot warmer than your opposite leg. So this is one of the most common symptoms of a DVT, so check for the temperature of the skin of the calf. Second is calf pain. So that same side calf is typically going to be tender to the touch, and if you put a little bit of light pressure on that leg, it's going to be very uncomfortable. Some patients will even report that they feel like their leg is throbbing, and this will get worse, especially in a standing position. So calf pain is another symptom you have to look out for. Third is swelling. Now, after any of these procedures, you're going to have swelling at that joint, but also down the leg and even in the calf. So it is normal to expect some level of swelling at the calf, but if you notice the swelling is increased more than it was in the previous day or two, that's another possible sign that a DVT is occurring. Last is skin discoloration. So similar to the swelling, after one of these procedures, it is also common to have some extent of skin discoloration, but on top of having more visible veins, but with the other symptoms that we talked about, if you also have a significant amount of skin discoloration, that's another sign of a DVT that you want to look out for. Now, the warning signs of a pulmonary embolism or a PE are lightheadedness, chest pain, and shortness of breath. So individuals who experience these symptoms along with the DVT symptoms are typically urged to call emergency services, as they may be suspected to have DVT and or a pulmonary embolism. So what are the best ways to decrease the likelihood of a DVT from occurring? First is elevation. So after surgery, icing is going to be pretty constant on the hip or on the knee. So while a person is icing, it's imperative that they elevate the leg above the level of their heart. That way, it's going to increase blood flow and circulation to decrease the chances of a DVT from developing. Second is periodic movement. So even while a person is icing, they can still work on ankle pumps while they're icing their hip or knee with the leg elevated. And when they're taking a break from icing, they can stand up, they can change their position, they can walk a little bit. I try to focus on having patients move every 1 to 2 hours to make sure that they're getting their circulation and the blood essentially flowing more often to decrease the chances of a DVT.